thank you, and thank you all for coming to the webinar. And we'll get started. I like to do these, where we go through the presentation, and then we have some time for question and answer. So I'm Michael Gold. I'm a dermatologist in Nashville, Tennessee, and I have spent years looking at acne and have been intimately involved in how do we use technology to further the efforts of our treatments in a digital age. And I've often been quoted as saying that we walk around with our cell phones and our tablets, and we use our laptops like we are tonight and so forth, or desktops. We get information about diseases from computers and our phones and everything else. Why not start thinking about using technology for our acne? And there's reasons why I say that, and hopefully that'll come out a little bit in this webinar tonight. I want to thank Aerolase and the team there for letting me do this. And I'm moving the show. So this is who I am. So I'm in Nashville, Tennessee, and I always tell people I spend an inordinate amount of time in China, doing a lot of teaching, and in Asia and around the world. I'm very fortunate at what I do, and have been involved with lasers and light sources for well over 20 years. Have many in my office that are used on a regular basis, and quite frankly, the Neo gets turned on in the morning, and for our acne patients, and it doesn't get shut off until I go home. So we like that. And the nice part for my world is that, and we can talk about this later, it's a cash-based business. It's a little bit different in how you price it maybe than you would somebody coming in for full-face facial resurfacing with wrinkles, because we're dealing with younger people for the most part, and we're not curing their acne per se, although we get really long-term and really nice results. So let's talk about, just for a minute, and again, we have a very mixed audience on the phone with us. Acne is a very common disease. There are lots of different reports out there. Some note that about 94% of all people will have acne at some point in their lives, males and females. It's not just for teenagers. If you look at what the medical companies are doing, they're spending an inordinate amount of money talking about the young female or the adult young female, because that is a huge market, and again, a perfect spot for the Neo device that we're going to be talking about tonight. We need to be aware that we have mild, moderate, and severe acne. Most patients come to me after they've been on a lot of other things. I am not usually the first person that somebody's going to come to anymore, although as dermatologists, we like to think that. So if you're a primary care doc out there, or family doc, or whatever, you're going to see a lot of acne. And the biggest thing that you have to determine is what kind of acne it is and what are the best treatments out there. And so in the real world, you have medicines and devices. And so you have to make a decision when it's appropriate to use your medicines, when it's appropriate to use your devices. My patients are, as I said, are a little bit different in that a lot of them come in on medicines, and what I try to do is maximize their medical care. And we introduce the devices pretty early in their treatment because, again, medicines take time to work. And so if you look at any of the medical trials for topicals or even systemic, some of them take up to 8 to 12 weeks to be effective. And I always tell my patients want to be better yesterday, so I need to be using my medicines, but I also need to be using devices which work really fast, within a couple days. So, we're at a really nice benefit for our patients when we can get them better faster. And so, again, I spend a lot of time with acne patients, getting them on medicines and getting them knowledge about what our devices can do, what Neo can do, and so forth. So we have lots of treatment options, and as it says here, medical therapy is the gold standard for acne. And again, there are different regimens out there, and there's different guidelines. The American Academy of Dermatology has wonderful guidelines on how they treat and how they recommend we start with retinoids and then add antibiotics and topical agents and whether you need systemic things later. We have, and I don't do that always. I sort of look at the patient and judge what they need, and most of my patients have a big inflammatory component. I want them on something anti-inflammatory pretty quickly. So we have topical and systemic antibiotics. We have topical benzoyl peroxides, which are now over-the-counter, every one of them, salicylic acids, various sulfa derivatives. We do have some new combination medicines. Combination medicines with benzoyl peroxide and clindamycin are very important in our world, and we use them. We have some newer ones that are a little more powerful than some of the older ones. Again, most of them are being marketed not only to the teenagers, but to the young adult female, because that's a very big target. We actually also have topical dapsone gel, which is a very popular topical dermatologic agent, and we use that a lot in our patients. It has wonderful anti-inflammatory effects. And again, we have retinoids, topically and systemic, with isotretinoin or Accutane, which doesn't exist anymore, but we have generics of Accutane that we still use when we're needed. And I always tell my patients, if you're thinking about Accutane, give me 30 days, which is what the wait period is if you're a female and you need to get on birth control with the iPledge system. And for the most part, I can have most of your acne cleared. So I don't have a ton of patients on Accutane anymore, but I do reserve it for when I need to use it. There are a couple different things that you have to remember about acne that are problematic. And this is across the board. None of this is new. As I said, topical therapies take a long time. Systemic antibiotics, even the minocyclines and doxycyclines that we use the most, have bacterial resistance issues. So we are more prone to not want to keep patients on them for long periods of time, or patients don't want to keep themselves on it for a long period of time. There is a report back in 2004 that if you use systemic antibiotics like minocycline for long periods of time, you can get an increased risk of breast cancer. I'm not sure that's ever been substantiated, but it's there and it's in the literature. And there is a report in the Archives of Dermatology in 2005 that says systemic antibiotics increase the risk of just generalized infections when we have them on chronic minocycline and doxycycline. And then I have a question mark, the effect of the iPledge system. Well, we know it works, and if you don't know the iPledge system, I could spend 2 hours talking about it, so I'm not. But iPledge is basically a government program where if you want to give somebody Accutane, you, the pharmacy, and the patient must get on the computer, do a bunch of work, and everything's got to match up so that they get their medicines. And it's a monitoring system, so we make sure the patients only get what they're supposed to get, only for the amount of time they're supposed to get it. There are no refills when we do that. And it's a check and balance because, again, we don't want females getting pregnant. We don't want people jumping off bridges. So it's a way we have to see our patients, make sure we monitor them, and so forth. But, again, that's a concern. So when we talk about lasers and lights, we have three main premises or three main ways that we treat acne. We actually go after the P. acnes itself. You can do that with a variety of different lasers and light sources, so whether you're using blue light, IPLs, the Neo, vascular lasers in general, all of these work by destroying the P. acnes bacteria. It's almost, I call it almost like a PDT type of reaction without using a photosensitizer. You can destroy the entire sebaceous gland and the sebaceous output. There are devices in the near-infrared range, one in particular that was very popular about 10 years ago. Most patients couldn't stand the pain that was associated with it, so it's rarely used anymore, that particular device, but others exist, and on occasion we do that. And then there's what we call partial destruction of the sebaceous gland and destruction of P. acnes, and that's through the use of photodynamic therapy. And it's with some newer compounds that you'll hear about over the next 5 years that are being developed that are nanoparticle deliveries using light sources that do the same kind of thing. So we're still, we're in a really nice spot because we have some great things that work now, and we're going to be looking at other things in the future to see how we can make things even better. So again, this is old. This is almost 10 years. I've been writing about devices for acne for years. Again, I'm a big proponent of technology, and this is one that we wrote. Others, Gilly Munavali, Bob Weiss, again, experts in lasers, expert dermatologists have written about their experiences. And in Europe, this is from the British Journal of Dermatology, in Europe we're seeing a major increase in the use of devices with the right patients and right kind of hands, just because, again, they work so well. So we have selective photothermolysis of blood vessels. Again, we know that some of our vascular lasers and the IPLs and so forth target blood vessels. We can reduce the inflammation around it, but again, as I said, we're really destroying P. acnes, which is this phototoxic or bactericidal effect that we have on the P. acne bacteria. And with depeding, we're obviously doing something to the sebaceous gland with these devices. And you put all three of them together, again, this is what Neo does, this is what others do. It gives us a wonderful way to go and treat our patients with acne. So again, we have devices that have been used historically, and again, I've talked about some of them. The vascular lasers are number one. The infrared are for the most part, if they're low, the 1320s don't hurt very much and they're not that effective with acne, and the 1540s or 1450s, they penetrated really well, but they hurt a lot, we don't use a lot of them anymore for acne. And the long pulse 1064, even though its peak absorption is hemoglobin, and that's good for us, it really doesn't help tons when we're treating our acne patients. So Neo is short pulse 1064, 650 microsecond 1064 laser for acne, and it's painless. And the best part of this machine, which we don't even talk about anymore, and I should have put it up there and I didn't, it's a device that fits, that is basically in a suitcase that you could put in the overhead compartment of an airplane. So it's portable, it's very portable. And when you treat patients, it doesn't hurt. So it's a painless device, it's a portable device, and so if you're not fortunate to be in a 20,000 square foot office with 50 exam rooms, and you're in a city or in an office that has 3 or 4 exam rooms, and you want to cram 10 devices in there, it's hard. This is basically, as I said, it's the size of an overhead suitcase, what you put in the luggage compartment of the airplane, and there's no space concerns for this. So it's one of those devices that meets so many of the criteria that we want, safety, efficacy, convenience, and doesn't take up room. And that's a big deal. And so you need to be thinking like that or thinking of that, because that's really important. So again, when you do these three things, you can get, with the shorter pulse, gentle pulsing, stacking of pulses that allow us to get in there and treat these patients that have moderate to severe acne. So there was a clinical study that was presented at the ASLMS last year by Khalil Khatri, again, a great group, and Natalia Garaskova, where they looked at 100 patients with moderate to severe acne, all ages that were less than 25, and again, these patients were on no topicals. You see the laser settings that were used here, no complications, no hyperpigmentation, no burns, no scars, or increase in acne. And again, when you think about this or you know anything about acne, sometimes when you give medicines, they flare. So we don't want them to flare, and that's good. And there was a high patient satisfaction, particularly due to the rapid and aesthetically pleasing results. So patients got better in this study. And again, I used this on my teenage population, and again, I used it on my adult population because patients want to get better, and again, they want to get better faster, and this is our ticket to getting patients better. So you clean and dry the treatment site, you preheat the facial vasculature and sebaceous glands with lower fluences, which are usually 2 to 3 passes across the site, anywhere from 14 to 28 joules per centimeter squared. You apply higher fluences directly on each lesion, and you do as many pulses as you really want. Again, it doesn't hurt. The lesions will become pale, and you'll actually see some shrinkage in some of them almost immediately, and that's wonderful for the patients to see. You're not going to make every lesion disappear the first time you treat them, but you do see some improvement, and again, patients like seeing that, and so that's very helpful. As I said, it doesn't hurt, so you can go over and over it until you get your desired results. So I want to show you what this does. I mean, I could talk about it all day, but until you see it and do it, it's hard. So this is not my patient, but this is Natalia's patient from that clinical study. Again, you're looking at somebody with moderate to severe treatments, moderate to severe inflammatory acne, and look at her before and after. It's 3 treatments. And I do these every 2 weeks. You can do it every month. You can do it every whatever. My preference is every 2 to 3 weeks. And if I can take her before and tell her in 6 weeks this is what she's going to look like, this is wonderful. Now the Neo is not going to treat scars. I mean, it'll improve some of the scarring. All these devices smooth out the skin somewhat, but this is not going to be my #1 go-to for scarring. But with her, and again, this was part of the study, so this was without any medicines, that's pretty darn good treatment that you get from that. Because it's a 1064, it doesn't care about color of your skin. So here's a patient, again, before and after 3 treatments, African-American, dark skin, and you see the kind of results you get. You don't get post-inflammatory hyperpigmentation. Again, really, really happy patients that you can treat this way. Another patient here, again, darker skinned individual, really bad inflammatory acne, and again, after 3 treatments, you can see the marked improvement you get. And another patient here, and this is a very common acne presentation where lots in the temples, and patients sometimes don't want to put medicine by their hair or things like that. This is a great opportunity for the light sources like Neo to work here. Again, this is one of the things we found out really quickly when we started using devices. Even though we always think they're best for inflammatory acne, we know from many clinical studies that have been done on all these devices that we're not only getting the inflammatory component, but we're making the non-inflammatory acne better as well. So you see in this individual with all these comedones around the mouth, again, 3 treatments later, it's gone. So here are some of my patients, and again, the reality is you have to understand some of the stories, and I'll get to some of the stories of some of these people. But you can see some really bad inflammatory acne here with numerous cysts and so forth. So you need to be aggressive, with medicines. In this case, the patient was on some oral and topical medicines, but not getting better. And then 2 treatments with the Neo, you see what we were able to achieve. And again, somebody with a really bad inflammatory acne on the forehead, darker skin patient, this is better. So here's the sort of the patient that changed my view of all this. And again, you have to understand the story. This patient, who I've known for years and treated her when she was a teenager with 3 courses of isotretinoin, and it didn't work. Every time she got on the drug, she did well. Every time she got off the drug, she flared. And she had a mobile living thing where she had to go away at times, and so I would see her every so often, and she came back a few years ago and said, help me again, and I don't want to take isotretinoin. So I want you to sit there and go, okay, she comes to you looking like this on the left, and she does not want to take isotretinoin. And so if you're thinking, okay, she's got these huge cysts, the first thing I'm going to do is excise these cysts, that's wrong. You don't want to do anything that's going to cause more scarring. So you've got to think about how you would approach her. And again, we did use some systemic and topical medicines, but you see she's 6 treatments, she's post 13 months now, and she's all clear. And here is the side view of the same patient. And this is where this is why you go to work every day. This is what makes it worthwhile. This is why I do what I do, and my staff, most of which is listening, this is what we do all day, and this is what makes it worthwhile. So you can use, some intralesional steroids if you need to, and you can use some medicine, but that's not going to take care of this problem. And again, this is what Neo did, and this is what Neo does. And so, again, in combination with your medicines, which take a long time to work, the Neo works quickly, and this is 3 months of treatment every 2 weeks for six treatments, and she's a year out. And again, I put her against anything that I do for acne for efficacy and what you can get out of this kind of treatment. So if you have any questions on acne, submit them, and I'm not sure how you're submitting them, but I would assume that you're going to type them. I'm asking the host how you want to handle questions. So, I'm not done, so I'm going to keep talking. But if you have questions, you can start submitting them now at the question and answer on your screen. But I don't want to stop here because this is an interesting device. So, it's a 1064 laser. Even its short pulse and its target is mainly hemoglobin, it works for a lot of things. And so the versatility of this is also something that you need to consider. As I said, I'm in a different environment than most everybody on this call. I got 40-some-odd devices. I'll use a lot of different things because I have it available. But when you're picking and choosing what you want to use in your clinic, you've got to say, okay, well, I treat a lot of acne, and this may be a good thing, but acne is not everything I see all day. What else can I use it for? And so, here are some cases of hair reduction. Again, it's 1064, so it doesn't care what color you are. And we know that 1064 long pulse is the safest for hair removal. Well, 1064 short pulse is the same. It's safe, and it's safe on dark skin. So all of these patients work really well. So here's a case of mine. And this is a very common thing we see. This is the pseudofolliculitis Barbie, which is related to hair, but you got to treat as almost like a hair reduction device when you're treating with lasers and light sources to make these papular lesions go away. And if you biopsy this papular lesion on the left, it's really a scar. So this is where the hair is growing up. It's twisting around, it's nicking the skin, and we get what lay people call hair bumps. And we see them on the face, and we see them a ton on the back of the neck and the back of the scalp. But again, this device works incredibly well, and this is the same guy. So here he is, four treatments, 4 months post 4 treatments, and here he is 18 months, post 4 treatments. So again, once we get there, this is lasting, which is wonderful for our patients. Another patient, again, very common that you see, this is a patient, again, dark skin, who tweezes because those hairs are bothering the heck out of her. And this is just with 1 treatment. You can see the marked improvement. Now, we're not done yet, but we'll keep getting, and in a couple more treatments, this will be clear. So, again, you can use it for a lot of different things. This is for skin tightening. Again, 1064 is one of those wavelengths that early on was actually compared to thermage for skin tightening, radiofrequency. There was a guy named Mark Taylor who did this incredible study looking at 1064 wavelengths for skin tightening, and we were able to show skin tightening. And so you can do the same thing with this device if that's what you choose to do. And again, it's a vascular laser. So we know it's going to work on blood vessels. So here's some facial veins. This is one treatment, zap, bye. And you actually can look at the one on the left. They're almost like depressed vascular lesions for some reason, but they're gone they're gone at this point. So we get this all the time. So here's a patient of mine who had a filler injection given, and I'm not even sure if it was at my office or not. I would hope it's not, but probably was, and bruised a couple days after the filler. We know that vascular lasers work really well on post-filler bruising, and this is just a couple days after one treatment. We can make those bruises get better. So again, very versatile device. The redness from rosacea, vascular lasers should be part of everybody's talking when you're talking about how you treat rosacea. Again, we have some really neat new topical medicines, some of which work really well, some of which work a little bit well, but patients don't want to be on antibiotics forever and a day. So rosacea is a vascular phenomenon disease, and if you can treat the vasculature, why not make it go away quicker? And so, again, this works exceptionally well. I see something called poikiloderma a lot. Poikiloderma is this weird redness, crepiness that people get on their face, on their necks and chests, and we can make that go away really quickly. It's really common in females, but I also see it in males. This is a male, and again, we can make this go away without much difficulty in our patients. And again, these are really happy patients because this is painless. And I keep stressing the fact that Neo is painless, and that's important. And if you look at this one in the bottom lip, right in the middle, there's a little blood vessel there. Again, one zap and it's gone, and so forth. But what about pigment? So 1064, short pulse 1064 actually helps pigment too. So we got a laser that makes acne get better, vascular get better, pigment get better, removes hair. And again, it's portable. This is unbelievably useful for our patients and for things that you can do for you. So this is patient comfort. I love the fact that it has no consumables. The market in lasers, it's an interesting thing. The consumable parts of the laser business has become very popular because the companies sell a device and, that's it. If they sell a device and they sell a consumable, they get the best of both worlds. This doesn't have a consumable. That's great for us. So I don't like things that have consumables, but in reality, that's becoming the norm. For this one, there's no service contract required. The new technology platform eliminates optical fibers. There's no water circular system. And again, it's portable, which is really used. If the device does not work for some reason, and the guys can correct me if I'm wrong, you just ship it back overnight, and they ship you one while they're fixing yours. It's really painless and it's really seamless when you do that. So that's really helpful. And I think that's my last slide. So I'm happy to open it up for questions. I do want to talk about pricing for a minute because I think it's really important. So, and pricing is varied based on location, in where you are. So if you're in the United States, it's going to be different than if you're in China or in India. But if you're in the United States, the pricing is going to be different if you're in New York or Los Angeles versus maybe Nashville, Tennessee. That also is a reality of life, and it's not going to change anytime soon, so you've just got to get used to that concept. But with acne, so if I'm doing a procedure and, if I'm doing a whatever procedure and I'm charging, $400 or $500 for that treatment, I can't do that for acne. I just mentally, morally, or whatever, I can't charge my teenagers whose parents are usually paying the bill that kind of money. So our fees for this range from about $150 to $200, and that's it. When we're doing the cosmetic procedures like poikiloderma or we're doing vascular lesions or whatever, I charge whatever I normally charge for that. But for acne, I'll stress to you to keep the prices in the what I call the reasonable range, just because it's cash and they're young, and it's disposable income that many of them don't have. And I look at it, if you do enough on volume, this is a no-brainer. So again, that's something you all have to figure out. I will tell you, this is not codable. You cannot charge this as a destruction. I don't care who tells you what in your billing offices or your consultants or companies out there that I've heard have done this. I know of several physicians around the country that have had to pay back hundreds and hundreds of thousands of dollars because they charged this as a destruction code, not with Neo, but with another device. And when they got audited and realized it was a laser procedure, when you mention laser, 99.9% it's cosmetic. And so this is cosmetic. So keep it that way, but keep it reasonable. So with that, let's open it up for questions, if you have any questions, and we'll go from there. So thank you for all listening.
So Dr. Gold, is there any special considerations for darker skin patients?
Not really. I mean, it works so well on darker. I mean, any 1064 works really well on darker skin patients. So, the skin of color business is expanding. It's huge. It's half the population, if not by now, in the next few years. So again, this works. I don't think we do anything majorly different in those patients. So no, not for us. It's not a big deal.
All right, and then we also have a question here. How long do you tell patients the acne effects last after a series of Neo treatments?
So, again, it's a great question. So, again, I tell my patients, first and foremost, I'm not curing their acne. But what we see when we do this, again, no matter what kind of device we're using, but you saw with the Neo that I showed, when you get people clear, that clearing can last a long time. So even when I treat patients with Accutane, I never tell my Accutane patients, you're never going to get another pimple. You always are going to get another pimple, or the potential for another pimple. So you got to be realistic, and you got to be honest with your patients. They still can break out. They still can get a pimple here and there. But what I've seen over time is that when the patients do break out, two things happen. They get in immediately because they don't want that pimple, and when they do have a breakout, for the most part, it's not as bad as the last one. So, it's easier to take care of. But, we don't have any long-term data on any of this. I know I do a lot of PDT work and have done studies on PDT for acne for, in years past. We know with PDT that patients, the longest follow-up that I've ever seen reported is 5 years. Is that a cure? Probably, but we don't know. So it's long-term, but I don't have the answer on how long.
All right, excellent. We have another one here. Does a patient need to stop minocycline for a certain time before laser treatment, and if so, how long?
So that's a great question, too. Do you need to stop drugs before you do this? Absolutely not. The antibiotics that we use, minocycline, doxycycline, are not affected by this wavelength of light. I keep everybody that's on it on them, and I never have had an issue.
Okay, and then in terms of using the Neo for acne, are there set settings that you use, or does that just depend on patient to patient?
It's patient to patient. There's a slide in there that the company will be happy to share with you on how we do it, and that's how we start. And yeah, it's patient to patient.
Okay. And then in terms of the course of laser acne treatments, what skincare do you typically recommend at home between treatments?
Well, again, we are going to recommend to our patients that they be on an acne routine. So skincare is, to me, I treat skincare as cosmeceuticals or things like that. So my patients are, if I'm treating them, they're on a medicine in the morning, a medicine at night. They use sunscreen. Sunscreen is really important, but we have to make sure it's the right sunscreen, and especially in the summer. But, skincare-wise, you can use anything you want that's non-acne forming. So there's lots of products out there that are, you can use over-the-counter that are non-comedogenic and all that other stuff. So that kind of stuff.
All right, excellent. We have another question in terms of other therapies here. Would you inject TAC into the cysts on the same day of Neo treatments?
Yeah.
And also, how long would you take someone off of Accutane prior to doing any laser treatments?
All right, so that's probably the best question. So here's the rules and the regulations, and then there's the how I do it, which are different than the rules and regulations. So the rules there's no rule, okay? The literature out there is related to dermabrasion and isotretinoin or Accutane. The first paper came out in 1990, when I was a resident, or 1991, 1987 or 8, when I was a resident at Northwestern. This is where these papers came from. I was not part of them, and I'm glad I wasn't part of them. But one of them said that if you do dermabrasion within 6 months of isotretinoin, you have an increased risk of scarring, potentially. The second one said if you do it within a year, you have an increased risk of scarring. That's problematic. So most patients, as a rule, should not be treated with a laser or light source for 6 months. That's resurfacing. When we're talking about acne and hair removal and those kind of things, we have enough in the literature today that suggests that if you actually treat these people while on isotretinoin, you're not going to come into problems, okay? Having said that, if you come into problems, you're going to be hard-pressed. If there's a lawsuit, you'll have enough people that will come to your defense if you do everything right on the treatment, but the literature is the literature. And these two papers are the standard, and they still are. So having said that, if I'm doing acne or hair removal, I would probably tell you to wait at least 3 or 4 months. But I also could see the rationale to do it immediately. So it's a tough question. I hope that helps a little bit.
All right, perfect. We also have a question about actually treating acne with the Neo, and this person was wondering about your results in terms of, would you say that it's better to do multiple treatments during the week, or do you think the treatment should be spaced out?
So I treat my patients every other week. Okay, so I don't treat them multiple times with a device during the week, if that makes sense to everybody. I will treat them, and I'll bring them back 2 weeks later, and I'll bring them back 2 weeks later. So that's how I do it.
And in terms of patients who have either acne rosacea, and it's not clear if it's one or the other, how can you actually tell that?
If it's not one or the other, rosacea?
Either acne or rosacea.
Okay, so again, if you acne is acne, Rosacea is a different animal. Rosacea is often misdiagnosed in out there, period. People come in with red faces. People go, you have rosacea. Depending on the patient, the ethnicity, where they're from, they may have actinic damage or they may have something else and a pimple. So, if you don't know the difference on how to diagnose acne and rosacea and you're not sure, send that person to a dermatologist. It's the easiest way. I can look and in 5 seconds I know what they have. So, but rosacea's got papules, pustules, and blood vessels. Acne doesn't have blood vessels. Okay, the pattern of where rosacea is mainly cheeks and nose, where you don't see rosacea usually on the forehead. That's not always, but there's differences.
All right, very good. And then in terms of male patients, and if they have acne in the beard area,
yeah, you got to be careful.
Got to be careful.
I mean, you do. I mean, again, you have to explain to them that they may have some hair loss in the beard area. So you've just got to be careful. It won't stop me, but you got to be careful.
Are there any other supplements or skincare regimens that you recommend in terms of stopping acne inflammation?
So I'm not a supplement person. If you come to my office, I sell one supplement for hair just because I know the person that did the research on it. But these are not FDA-cleared things, supplements, and I'm just not a fan. I don't, if you go to your vitamin shop and you get, brand X for acne, skin, and hair, and nose, and nails, and toes, what's it doing? I mean, it's got nothing in it that's going to do anything for your skin. So I'm not a fan.
All right, thank you very much. And then last but not least, how long does a typical treatment session take with the Neo?
The actual laser, 5 minutes, 10 minutes.
Okay, very good. All right, well, Dr. Gold, we do appreciate that. And if you have any other comments.
Well, I mean, if we don't have any more questions, again, I would tell you this is one of those devices that I mean, it's really special. And again, I do a lot of talks for a lot of laser companies, and this one I like a whole bunch. And so, if it's something that interests you, I would tell you to go find your Aerolase people, or contact them, or let them know from this webinar that you're interested. Bring it, try it, see what it does. I'm pretty comfortable that you'll be impressed. So I thank you all very much for joining us tonight. I thank Aerolase for hosting this, and we'll do it again sometime soon.